Dear followers, I'm pleased to introduce you to this new webinar series of privacy rules on COVID-19 response in the European countries. Together with us, we have our experts from Belgium, Geert Somers and Bernd Fiten, from Germany, Volker Wodianka, from Switzerland, Gabriel Avigdor. And with them, we are going to have a series of different episodes in which we will discuss different points related to our main topic, that is COVID-19. In particular, today we will hear more on what the data protection authorities of this country have issued against COVID-19. So without further delay, I would like to start our discussion, and I turn it over to Geert Somers in order to know more about Belgium.
Hey, Alessandro. So our Belgian supervisory authority came with an opinion on 13 March 2020, so 2 weeks ago, in which it gave advice on how to deal with the processing of health-related data in the context of the fight of the coronavirus. So what I'm going to tell you is, first of all, how does the Belgian GDPR interpret the legal basis, Article 6 and 9 from the GDPR, and what other recommendations did our authority provide? So first of all, the authority said that any processing should always be lawful under Article 6 and Article 9. And that as a private organization, you cannot simply invoke public health and public interest as an excuse for processing personal data if you don't have an explicit instruction to do so by a competent authority. And secondly, the other recommendations is that the general principles of the GDPR should, of course, be respected, mainly proportionality, data minimization, transparency, and security, meaning that always reflect whether you need the data for the purpose, whether you can do it with less data, whether you are informing the data subjects adequately, and whether you are protecting the data adequately. That is, in a nutshell, what our data protection authority said 2 weeks ago.
Thank you very much, Geert, for your brief introduction. And I would like now to turn it over to Volker Wodianka. Volker, what your DPA has issued in Germany?
Yeah, thank you. Actually, we in our federal system in Germany, we have more than one authority that is able to provide guidance to the competent businesses in the country. So we have various FAQ comments from the authorities as well. There's one comment or common publication from the so-called data protection conference, German Datenschutzkonferenz, which tries to summarize issues like collecting personal data from employees. What about also a very interesting aspect now, collection of mobile phone data, which is more in the direction of authorities now that try to figure out how and how much people are moving these days. Because that's one of the main aspects now, checking access control, employee personal data usage, health data. Sounds a little bit the same as in Belgium, always a legal basis needed. I think a focus is on legitimate interest. That's kind of interesting, I think.
Perfect, Volker. Thank you for your introduction. And Gabriel, I turn it over to you. What about Switzerland?
Thanks. So for Switzerland, the Federal Data Protection Commissioner issued a press release relating to COVID-19 on the 17th of March 2020. And 3 topics were explained. So the first one is how healthcare institutions can process personal data in the context of COVID-19. Obviously, those one will be processing most personal data in the context of COVID-19 because they will receive all those cases either directly or from an HCP, a healthcare professional, providing, disclosing information. The second one is a processing of personal data by private persons, so not public health institutions or governments, and basically a bit the same as my colleagues. The authority explains that first, it's sensitive data and you need to have a purpose and collect only what's needed and necessary and appropriate. And it gives the example that it should be relating to prevent cases. So it's really specific to COVID-19. And the rest is the other types of principle are the same. And then the third element is about body temperature and location tracking, which are interesting topics. And it's not forbidden to take body temperature, even though we can debate whether it's still necessary to do that. We can discuss this after. And location tracking is not forbidden neither. It's just that it should be proportionate for the purpose of preventing infections.
Perfect, Gabriel. Thank you very much also for your point of view. And speaking about the way in which the authorities are taking controls over people or employees, for example, I would like to ask to Bernd if in Belgium it's possible for organizations to conduct those kind of systematic controls, such as measuring body temperature for employees or for visitors.
This is considered disproportionate by the Belgian authority, because taking temperature and evaluating health-related systems should be left to qualified physician, and that could be the company's doctor, for example.
Perfect. Thank you very much, Bernd. And I would like to go back to Gabriel. Gabriel, keeping our discussion on the measures that have been used by the authorities in Switzerland, you mentioned tracking measures. So are you already using them in your country, and which are the main problems related to the use of such kind of measures?
Now, that's actually a very good question, because in Israel, for example, they've been pretty far, and in other countries as well, such as in Asian countries. No, in Switzerland, it's not something we are doing at the moment, and one of our federal counsel, Alain Berset, who is the responsible for the Department of Health, said explicitly that it's not something we would do to track people on an individual basis. It's a tool to understand how the epidemic works and how movement of people on an aggregate basis would be understood. So that's something that we are not currently doing, and we will see how and if we will use that measure.
Perfect. Thank you very much, Gabriel. And I would like now to move to the final question with Volker. Volker, I would like to conclude this session asking you something that is peculiar of your country, since Germany is a federal country. I was interested to ask you if there is a common statement in Germany or if every federal country is working and keep working independently.
Actually, everybody is working independently, but the so-called Datenschutzkonferenz is the let's say the agreed table where all the authorities come together and they issued a statement of certain aspects. So just to recommend for all the controllers that they always check in what federal state they are based, where's the residence. So always go to the competent authority for the specific questions and check their FAQs. You cannot rely on any statement of any authority in these cases.
Perfect. Thank you very much, Volker, and thank you to all our speakers of today. I also want to thank our listeners, hoping that they enjoyed this discussion, and I really invite them to follow Privacy Rules in order not to miss our next session on the challenges that COVID-19 is bringing into companies and which are the main solutions issued.